Welcome, everybody. Thank you for taking time out of your Monday morning to be with us this Member Monday for the Chamber. I believe our focus this morning is going to be on the senior community and what we're doing as a chamber to reach out to this important people group, and what needs you may have that you've come across that are either chamber related that we could assist with, or just getting feedback and input from other members who may be dealing with something similar, and what they're doing and how they're handling it, and making sure that we're taking care of this important segment of our community. So with that, let's go ahead and just do around the room introductions. And I'm just going to call you out as I see you on my screen. So when I call your name, just give us your name, organization, and how you specifically serve the senior community, if you do. And let's start with Warren.
Hi, I'm Warren Schultz. I'm with TAP Solutions. I don't directly serve the senior community. I just came to visit.
Okay, Mark.
Good morning, Mark Levinson. I'm a family law attorney. I help everybody, not just seniors.
Excellent. Abbas and Honey.
Good morning. Honey and Abbas with Remedy Home Health. We provide medical services to the patients' homes. Basically, we're here to make them comfortable and healthy as quickly as possible.
Like
Excellent.
she said.
Ditto. Carol.
Yeah, I'm with the Foundation for Senior Services, and we provide a one-stop shop for education and all kinds of services for the seniors and their families, whether it's pain management, medication management, counseling, financial services, and all of the above. And Joyce Robertson is the executive director of the foundation.
Excellent. Kevin.
Alan Pagucola, Banker Greater Valleys. I'm a certified senior specialist in real estate, so I help, in addition to helping everybody, including first-time buyers, of course, I also help seniors relocate, downsize to more appropriate living situations. For instance, as an example, I worked with this one client of mine for about a year and a half, downsizing from a 5,200 square foot, 3-level home in Sherman Oaks to a 1-level home in Encino. And the whole process took about a year and a half to find her place, her new place, and to prepare the old place for sale, and to move her 7 times. It took about 7 times to move her. So it's working with seniors is much more than just selling a house. There's much more to it and such. So that's what I do.
Great, thank you, Kevin. Lonnie.
Good morning, everyone. Lonnie Gershfeld, your copier, fax, printer, and multifunction specialist. We do everything from sales, leasing, rentals. We service all the brands that you may have. And we have, of course, toners that are half the price of the superstores, 1-year warranty. I am a senior myself, so I want to know what there is going on in the senior world for myself and others. And we do service the senior community. If any seniors need help, it doesn't matter if they have money, if they don't, we will get them working and fixed and do whatever we can to support them.
Excellent, thank you. Jerry Fisher.
Hi, Jerry Fisher with Paul Davis Insurance Services. We help the senior communities because we do help seniors with the Medicare health plan options. They do need special attention. We give it to them. We find the right plan for them.
Thank you, Jerry. Joyce.
Good morning. I'm Joyce Robertson with the Foundation for Senior Services. Happy to be with you this morning. And our senior specialist group services senior needs and their families at all levels of senior care. And we provide a lot of education to the community.
Very good. Paul Davis.
Hello, everyone. Paul Davis, Insurance Services. All we do is help people that are eligible for Medicare figure out the most appropriate plan, whether it's a Medicare supplement and a Part D or a Medicare Advantage plan. Most of the people we work with are 65 and older, and we shop them when they first turn 65, and we also help people that are coming off of group plans and entering the Medicare world for the first time.
All right, Ara.
Hi, good morning. This is Ara from Exemplary Care. We are a non-medical in-home care provider for seniors.
Thank you, Ara. Is it Kathy? It's like all one big long word. So
Yes, I'm Kathy. I'm with ARA. We're working private care for seniors, and we also do provide care staff for residential care facility for elderly.
excellent. Thank you for being here. Lainey.
Good morning, everybody. Lainey with Paratus Insurance Services. I think about 3 or 4 years ago, I noticed that when AARP started peddling insurance to seniors and writing through Hartford, that the policies were not well written, they were not well thought out, and they were not actually directed individually. And so I got a little frustrated, and I started looking over more and more policies and either having them adjust to their current policies or bring them over to our agency or an agency who could better help them. So Lainey Paratus Insurance Services, home, auto, commercial.
Excellent. Gary Burns.
Good morning. Well, you know, I'm a senior just like Lonnie, unfortunately, like many of us, but the unfortunate part is if we weren't fortunate, we wouldn't be here. So as you may know, I help businesses recover federal and state taxes that they and their CPA probably don't know about. But in a former life, I too was an insurance broker and have done Medicare and know a lot about the senior care industry in terms of helping place seniors in assisted facilities. So if anyone wants to use my knowledge from years and years of doing that, I'm welcome to give it to you as well.
Excellent. Thank you. Janice.
Good morning, Janice Killian with State Farm Insurance. We are honored to serve our senior clients as well and very happy to be here with all of you this morning. Janice Killian with State Farm Insurance.
All right, excellent. And we've got a few newcomers. Rodrigo, are you with us? What we're doing is just introducing ourselves, name, company, and then how you are involved with the senior community, if at all.
Hi, everyone. My name is Rodrigo. I'm a UCLA student enrolled in the Business Fundamentals and Marketing Certificate programs. And I work for the foundation as intern, helping with business development and marketing. And I'm happy to join this meeting and learn more and connect with you all. Have a good day.
Excellent, thank you. And Dan. Oh, you're muted, Dan.
I'm sorry. I'm Dan Nathanson. I'm the owner of Home Helpers of Thousand Oaks, and but I am also the chairman of the Foundation for Senior Services, and that's what really brought us here today. And thank you.
Excellent. Thanks for being on the call. And with the chamber, we have Eric.
Morning. I'm Eric Elliott. I'm the membership director for the Greater San Fernando Valley Chamber of Commerce.
And Fiumi.
Hi, Fiumi, also with the chamber, and I definitely have a big heart for the senior community. Our years ago, our community center was part of creating or building a new assisted living for the Japanese American community, and just kind of knowing how important different specialized services are and just what's going on with the senior community right now, we thought this was a really great place for us to kind of get together and find out what's going on. So thank you everybody for being here today. Nancy wishes she could be here. She's on a very well-deserved vacation today, but she does say hello. She wishes she was here.
Absolutely. And I'm Steve Rydeen. I'm with True Summit Promotions. I'm also the board chair for the San Fernando Valley Chamber. I serve, I think, who was it that they serve everybody? I do very similar. I've got a wide variety of clients, but I also do, especially during the COVID-19, the heart of it, April, May, I was doing a lot of helping out emergency management, county offices, home health care, retirement or assisted living centers with the 3-ply masks, the 3-ply disposable masks that were very hard to get a hold of. I had some great suppliers and resources for that, so I was able to help them out with get access to those types of products as well through all of this. And so did I miss anybody? I think I got everybody that's on the screen. I don't think we have anybody calling in. Is there anyone that I may have missed in the intros? All right. Yeah, so as mentioned, the purpose of this Member Monday is to discuss what's going on with our senior community and how we can assist them through their challenges with what's not not only going on with COVID-19, but also more recently what's going on with all of the fires and the air quality and the issue with that of not being able to be outside or go outside if they were doing that for exercise or just peace of mind to get out of the house for a little bit. Now that's kind of been closed again for a moment. So just to start a conversation, have a conversation around that, and either posing any questions or concerns that you've come across, or solutions to what you're doing or what your services provide that could address or remedy some of those issues and concerns. So we're going to start with just kind of opening the floor with whoever wants to start the conversation, and we'll go from there.
Well, for one, my industry really, luckily hasn't been, that's my cat, hasn't been hurt too much by COVID as demand's has remained strong and such, and sale prices are up still. However, our procedures changed a lot. We follow very tight protocols when showing properties. We don't hold open houses anymore, and every time we show a property, we have to wear masks and gloves and foot coverings and such, and to keep everybody safe. But as far as seniors go, it's just my priority is when working with them, obviously, to keep them as safe as possible. Bonnie. They have to be kept extra safe. I have several clients who are seniors, and I visit them from time to time, and yes, I know, Bonnie, no way. And I make extra efforts to keep them safe, as I can bring the virus to them. So I have to be very careful with them. And Bonnie, she likes attention. As you can see, Bonnie, go away. Anyway.
I can also open up by sharing. Kaiser wanted to be here today because they do a lot with the senior community. They weren't able to make it, so I can share some of the feedback she gave us to be able to share. And I know she's very interested in hearing kind of what's going on. But from their community health perspective, they're seeing a lot of social isolation, I can't speak right now, social isolation and food insecurity. And those are two of the big areas they're seeing a high need for their seniors. And I think they spoke with a colleague also at Northridge Hospital, and they're seeing a lot of that as well with their patients. So I think they're just kind of trying to figure out what are some of the issues, the barriers, the gaps they're seeing. How can, organizations like Kaiser help? How can they step into some of those gaps? I think that's kind of what also she's hoping that we can get out of this today. And as they do a lot of grant funding and things like that, how can they better serve the senior community, especially in obviously a time such as this, but also just in general. And so that's some feedback from Kaiser. So I don't know if anyone wants to piggyback off of that, or maybe has some other ideas of what are some of the priorities and issues happening in the community.
This is Joyce. Let me jump in if I may. So the Foundation for Senior Services, being a 501c3 public charity, we have found that turning all of our educational sessions across our 9 chapters, many of which are within LA County and a couple in San Fernando Valley area, we have turned virtual, obviously, as everybody has. And I'm happy to report that even though it's been difficult with helping our seniors behind the scenes remotely get on, we are seeing attendance on our public events really flourish. We just started the monthly SSG Academy, Senior Specialist Group Academy, that meets the first Wednesday of every month. We're going to be having our 3rd one on October 7th. And our first 2, I was so pleased that we had about 80 registrants. And so when we see the public coming in, and when we see the help with the social isolation that the virtual platform really helps the seniors, we're really pleased to continue to carry that out until we can be back in person. And we look for all of you to help us reach the communities, because we find that a lot of the consumers are not aware that we even exist. So we come to the chamber and groups like yours to see what you can do to help let people know about our education that exists, as well as our call center to call in for services.
How can you talk a little bit about how you were able to onboard a lot of the seniors to kind of get going with the technology, and you've been able to do that.
Yeah, I can chime in, and then Dan and Carol and Rodrigo are here from our organization as well, and they may have some points of view to add as well. Because we really reach out to our members to help us communicate the need, and then when we find a senior that has trouble zooming in, for example, we have our technical people behind the scenes that can help them figure out how easy it might be, even if they come in just via audio, or when we hear and before the meetings, we will give certain seniors that call in a little extra help about how to zoom in. Dan or Rodrigo or Carol, anything to add?
Carol, I don't have much to add on the on that. I think there is I think what we're seeing is the ability of seniors to at least get onto Zoom, and if you work with them, it's a doable thing in most cases. And I think that's going to be a vehicle that's important not only now but past when we're over with COVID, hopefully sometime. You know, so it is showing that we can do it. The question is, I think your question about how to do that and how to reach out. I think, you know, I think that's a good subject of conversation here. What's the best way to start training the senior population on Zoom and other technologies? Because it's definitely a benefit.
Yeah. I'm taking a lot of notes. So if you hear a click clacking, I apologize.
That is very true, because I you know, working with a lot of seniors, I find that many of them aren't even hooked up to computers. They may have a really old computer that they haven't upgraded in 15 or 20 years. And it's important to be able to educate them as to how they can reconnect with their family through technology. It certainly makes my life easier also as I work with them, because
there seems to be a big concern for those seniors that don't have that capability.
right.
You froze up, Fiyumi.
You froze. You're frozen.
We may have lost our host.
We may have, but
Yeah,
yeah,
we may
I think
have.
there was the concern around having access to that technology. Is there, is anyone on this call has dealt with that? You know of, you know, workshops or trainings or things that are available that specifically for helping seniors get connected to using Zoom or you know, even FaceTime or something like that?
That's specifically what Joyce was speaking to.
I'll jump in again. So the foundation has several custom classes with regard to how to use Zoom, not as an older adult that's still employed, as an older adult that's just retired. We just took on an agreement with Lacers, which is the Los Angeles City retirement system for all LA City employees, and we're taking them through a 10-course curriculum right now. And of course, it's our specialists on all different levels, technology in this case that we're talking about, that help provide them that kind of information. So we can certainly put together workshops for any of your groups. If you can bring together a team of people that want to benefit from that, we'd love to have you bring those people to our attention. We know a lot of our consumers that call in have put some of our programs up on the neighborhood internet sites, of course, Facebook, but these are people that already are used to getting onto technology. We also want to reach the ones that can, especially those that are in the lower income communities. We're seeing a huge problem there where they don't even have the bandwidth. They don't even have a way to connect. So we're always looking for partners that might want to go into a grant program or a grant application with us to try to seize on that technology program to help with the social isolation. So any of you that are able to collaborate with us in that regard, we'd love to pursue that.
All right, thank you, Joyce. And is that, are those like some of those trainings recorded ahead of time that they can send a link that they can watch or view to get that training, or do they need to register for a specific scheduled class, or how does that work?
We typically do all of our event registrations through our centralized event calendar on our foundationforseniorservices.org website. And then we have certain organizations that will call in that want it exclusive, and we can do that as well. So there is a registration process. The Zoom link is then forwarded to them several times. We'll do blasts about those and then follow up individually for those that need the technological support.
I have a question, Joyce. Are you finding it more an issue that they can't connect to the technology, or that they don't actually have a computer or tablet or technology at their home in order to be able to access?
Well, most of the classes we're doing, obviously they do have the technology, but where we're seeing the problem,
The ones you're not reaching, I'm asking, do you think it's more of they can't get on, or they don't have what they need to be able to access?
I think it's both. Let me give you an example. I don't know if you're familiar with Teleq Management. They reached out to us, and they are a facility that handles 32 residential communities for lower income older adults. And when they were in person, they were able to bring them into community rooms, and then they could be trained to get some of the virtual knowledge. Now they can't do that. And so they've asked us, and this really kind of breaks my heart, because the only option they have right now is, could we do 30-minute phone calls to some of these people to communicate education to them that they so desperately need, because there is such a lack of iPhones, smart tablets, let's say, and then of course the bandwidth out into their residences. So it's a real problem, and that's just one example of a community, many of which are within the San Fernando Valley area, some of those 32 residences. So
I'm wondering,
all of them.
So I guess then the question is there a way to reach out to an organization, even like LAUSD, that refurbishes all those and get their leftovers, their extras? I mean, there's so many computers. We just got like 40 computers donated to our PAL Center for the kids to do tutoring. There's got to be ways to get access to these systems to get them into the hands of the seniors.
Or even calling Apple to maybe to ask for help from Apple directly, you know, just older versions of their iPads, for instance.
Right. My own personal business in the senior space is a small IT full service support company. And we have relationships with Apple and Microsoft, and I put the word out there. We've also gotten a lot of donations over time, but one problem with some of the donations of the older computers, they are fraught with other problems because of the technology and the operating systems that are being used. And we find that to be a problem as well. But it's a huge need, and we are really looking for support of how to either get a hold of those computers, like you mentioned, the university. Dan, for example, our chairman of the board, he is a professor over at UCLA as well. And I know we're trying to put feelers out within UCLA, for example, to see what we can do and where we can find the technology, and then establish a program in some of these lower income areas.
I would think if LAUSD could get a computer into every single kid's hand, it shouldn't be that hard to get hundreds of computers donated. It can't be that hard. I don't know how to do it.
Right. And it's doable. We just brought together a couple education advisory councils, one being our education advisory council. We have 13 very valuable members on that group. And we're really looking at that challenge, and you bring up such an important point. And I agree with you, they're out there. It's what's our method and how do we go about putting that program together. I know Department of Aging has asked us whatever we can do in that regard. They'd even like us to do a Hispanic educational outreach in some of the LA City areas. So of course our foundation's cause is to reach diversity of all seniors, and that's down the road for us, but that's why we need more collaborative partners within the communities that we serve. And I'd love to see any of you within the San Fernando Valley get more involved with us.
Sure. Joyce, can you put your contact information on the chat, possibly?
Sure will.
Great.
And I just wanted to throw this out there. There's Pinebook computers, which are super cheap laptops. They're like $100. They run Linux, but they can run Chrome and Zoom and all that. So, you know, this cheap, it might be an alternative too. So I would definitely look into that, because it does run Linux, but there's pluses and pros and cons with that. But with seniors, if they're just running, you know, Chrome and the Zoom, that I think that would be a great alternative, and it's very easy to set up support and then be able to remote in and help those people afterwards as well. And it's $100 computer, so might be an option.
Great.
Now, that's a great option, Eric. I want to look into that. Maybe you can help us.
I'll do some research and I'll see what I can do.
Hey, Joyce, what was your experience working with Apple as far as possibly bringing in slightly outdated iPads that they may have that maybe didn't sell? Of course, they all sell, but you never know.
The issue is getting to the right authority figure within Apple. Now, we work with a lot of people, regional levels, et cetera, but I'm still working to climb up that chain within Apple. Somebody introduced me to a contact up north that's already made some headway with Apple. I can't, as this is a recent contact, and he's trying to do a similar thing in the San Francisco area. So I'm still trying to reach him to see what we might be able to do in that regard.
Next, I would think they'd have social outreach.
Yeah, and
Department
Dan, you might address a couple of those other organizations I know you've been talking about. One I think is up north as well.
I'm not sure what you.
Oculus, or maybe
Well,
our
look,
front porch.
Well, we're talking primarily. Yes, okay. I'm sorry. I was focused on our conversation regarding Zoom, and I think
Right.
that's the biggest communication device, that or way to get people out. But a lot of organizations are finding now that there's other technologies that actually stimulate the brain. It's good for Alzheimer's and dementia patients, like VR. There's all kinds of other technologies like the robotics that are being used. You ever see the robotic dogs that people are using for dementia patients? They really simulate a real animal, and they're loved. So there's a lot of things on the technology front that I think we need to be exploring. And my daughter happens to work for Oculus, and she's a VR in VR and virtual reality, and that is really we're looking into trying to do some kind of experiments, further experiments, and getting the VR sets into the hands of the seniors. They're really getting great experiences, especially when, you're stuck. Okay, you can go and travel the world through a VR reality kind of experience. And it's apparently very stimulating for seniors, as well as all of us, I guess. I'm a senior anyway, so for me too.
If I may, I'd like also to share about the telehealth. Ms. Joyce Robertson, this is very vital when it comes to the seniors, because they basically don't have any idea how this works with their physicians or RNs or nurse practitioner. So if you have these volunteers and you have this equipment, whether it's a tablet or a laptop, it will be very good to have a training or an educational something that will help the family caregivers or the institution that they are in to help with the telehealth in communicating and making sure that both sides are clear, because this is the one way for them to get better, whether it's physical, emotional, or in connection, everything, especially with the home health. Oh, they're gone. The home health is more of physical, but since now everything is telehealth, it has to be fine tune on how they can make use of this and maximize the usage of it. I think that's one way your organization can help, widen the usage of the telehealth.
Yeah, could I just say something about that? And just broaden the subject a little bit. We talked about the technology getting into the hands and the telehealth, et cetera. I think we need, call it a distribution channel, to use a business term, basically. We need basically the organizations that are dealing with elderly people, whether you're talking about skilled nursing facilities or assisted living, you're talking about churches, religious groups, any groups that are there. If we could work in conjunction with them and then add individual people by attracting them basically through the internet, except we're trying to get people on the internet. That's a little bit of the issue. But trying to get groups of people and working programs through these groups, whether they're businesses even. So in fact, at UCLA, I'm part of a UCLA support group that people just came together. A caregiver support group for family caregivers. They just came together and they realized that they were all suffering. So they meet every 2 weeks to just talk about all the issues they have. So working a program through groups like this really is important to get the outreach going. Now, I don't know if anybody has any ideas about how to best get that.
I do. So to me, that seems like the easy part. We just put together a program to get brown bag lunches to feed the homeless encampments. And so through the CD12 office and a couple of other outreach, we got Shepherd of the Hills, Freedom Church, Kiwanis groups, Rotary groups. We have about women's clubs. We have about 12 organizations that were willing to put these lunches together. It's not hard to find. People want something to do right now more than ever because they feel so helpless. So that's to me, I could help you find distribution channels in a second. We just need to know exactly what we're doing. And if we work it through CD12 office, we cover a lot of the San Fernando Valley, and then we could work through another district office because they really have a lot of access. And then you look at people like Abbas and Honey who are already in the homes with the seniors, and you go to organizations like that. But I would think distribution should be relatively simple, and I'm happy to jump in on that level.
Oh, that's great. That's great.
Oh, Janie, I am so excited to hear that. We'd love your contact information, and let's see what we can do together in that regard. We also just launched our employer assistance program, we're calling it, to reach the older adults that are still in the workforce and getting close to retirement. And that's another place we need help in finding those employers that can learn about the education we can bring. And in terms of the telehealth that you mentioned, what is it, Katrina? That is so important. We're getting calls to do an SSG Academy monthly webinar on how do I do telehealth. And so we bring together our member specialists to talk about that. So a few of our members are here on this call this morning, but we need to pull together that webinar program to speak and educate about exactly what you're talking about with the telehealth and telemedicine.
Now we can the door open for her.
Okay, okay, so I put Dan and Joyce, I put my contact information along with my cell phone in the chat.
Great.
So you guys call me anytime.
Great.
Boston, Honey, are you seeing similar things to what Katrina was talking about as far as needs with your clients?
Yeah.
So just to chime on that, so I know how a doctor can perform telehealth, or they can do a phone call and they can do it virtually, but our services are more direct. So in conjunction with having that telehealth visit, after they receive the doctor's order, we go in and administer those services directly. So physical therapy, you can't really do telehealth. You can't really do telehealth for a wound that needs to be dressed or taken care of, but it works in conjunction with laying out a great foundation for the seniors to know how to properly and adequately be able to converse with their doctor and keep their doctor in conjunction with, in the loop with us. So we do think that it's a really great opportunity to help and lay down that foundation for learning IT, where it might be how to use Zoom, how to connect to the internet. I think it'd be great, and we'd be more than willing to join in on that group and help out in any way we can if anything is to proceed further.
Yeah. I have a client, of course, I will not name the client. He is living alone. He has been sort of a little bit neglected for like 8 months. So no shower, no nothing, everything is filthy. So they requested for our service, but because we're non-medical, we can't work with them until we do something about it. So when I did the assessment, I came to his house. He has all this, skin tear, rashes and everything. And that's a work of a home health, I understand. However, nothing can be done if there's no doctor's order. That's why I came to the idea of, he needed a doctor's order and he can't go out because he is paralyzed and nobody would want to take him to the hospital. So the telehealth came in. And the thing is, nobody is ever willing to do that. And I did try, but the family wasn't cooperative. So if there was like a home health who can do the telehealth for just an assessment, to help him have a doctor's appointment through telehealth, then after which, if there's already the doctor's order, what are they going to do about his open wounds, his skin tears and stuff like that? That's the only time the home health can actually physically go to his place and tend to whatever he needs. And I think that's where the home health will come in. But I don't know if it's part of your service to help such that you will help this client to do the telehealth with the doctor. That's a question to you. I'm sorry, Abba and Honey?
Abbas and Honey, yeah.
Abbas and Honey, yeah. So that's actually where I am at. I just, being a non-medical, we can visit, but we can't touch because he is definitely out of shape, cannot stand, all not so good. And we need home health. But like I said, you are more physical, but can you come in and help him get, not just you, I mean, other home health. Is that part of your services?
We are limited by being able to provide those services with a doctor's order only.
Correct.
So here we find ourselves in a quarry where we need to get this gentleman actively seen by a doctor. It seems like he has family members that are not as available as we would prefer them to be. But surely he already has a primary care physician. So it's a matter of empowering him as the patient to have this conversation with his doctor. And if his current doctor is for some reason unwilling to provide telemedicine, then there's alternate doctors. So it sounds to me that before home health could come into play, he needs a patient advocate to set the ball in motion. So the question is who is the best to become his patient advocate? Mm-hmm. Sadly, it seems like it's not the family.
Yeah.
It seems like it's actually you.
Yeah. Actually, I'm leaning towards that because even though myself, I'm a state licensed administrator, so I can actually do it. And I did that, but it's just, I need a concrete help from medical part. And it always comes down to, we need a doctor's order before anything can really get done. So anyway, right. I'll do my best.
I think it's
a bit really difficult. It's very difficult. So it's okay.
I think it's been institutionalized that you physically have to go see a doctor. And now that everything is virtual, we haven't really acclimated to being able to do stuff virtually and have other resources such as home health, where our nurse or someone in our facility would go in and help and kind of be that middleman with the doctor and the patient. I think that'd be a great avenue to explore.
That's what I'm looking at from a home health. But I mean, they don't, I mean, no, there's only one person who's actually actively, helping him, but he's in Monterey. So he gave me, like authority to do this and that. But the thing is, I can find a home health that would accept a private pay, because this one needs to be coordinated either in Medicare or Medicaid, because he's only 52 years old. So definitely not Medicare.
Right.
So these things is something that I'm not very familiar with, and it goes a long process. And unfortunately, he's like being eaten alive with the open skin. I'm sorry, didn't mean to gross you guys, but this is the reality that a person needs help because he has been abandoned for 8 months to a year without shower, without anything, without cleaning. So, and he's paralyzed. So if you can imagine, he doesn't go to the toilet or whatever. I'm sorry, really didn't mean to gross you, but this is something that I am in a situation with that I do really need a little bit of help.
And he has no funds? He has no funds to get
He has no what?
Money.
Money.
Well, the brother has the money, but he lives in Monterey. So
He's not
there-
Medicaid?
I'm sorry?
Not
Medicaid.
benefiting from the state insurance?
Well, he did try, but because of his status, they didn't want to send anyone. I don't know what's wrong. So that's why they called a private home care to deal with it. But I cannot risk my caregivers going to his place because when I went there, it's really very toxic. We even had it clean, like entirely clean, but because of 8 months to a year without cleaning everywhere, it's just very filthy. And I said I wouldn't risk my caregivers coming in here to clean it up because they're not cleaners. They can do light housekeeping, but definitely not general cleaning. And the house, and he himself is not clean. But I can't touch him because he has, like I said, open wounds, meaning the entire body except from, his back and then his legs. So yeah, that's my problem right now.
Are they infected, do you know?
It looks like because there are some maggots coming out now. So
Maybe
that's
taking,
how-
just be
I'm
taken
sorry
to,
to gross you. I'm sorry, guys.
No, don't apologize, Kasia.
oh, now let's take them to some.
This is all too common, unfortunately.
Horrible.
Thank you for understanding. It's more of I'd like to help him start because he is only 52 years old. So, but he lost hope on starting anew again, and he's being eaten alive. That's my concern.
Exactly. And he's still so young. I mean, he's in his
50s.
52. The foundation, one of the members of our board is Dr. Jeremy Grosser. He's the medical director at Northridge Dignity. Dan and I are actually going to have a meeting with him next week just to go over some things as it relates to the foundation moving forward and a lot of the medical issues. We will bring this up to Dr. Grosser. As we have put together our advisory council on things of this nature, maybe we can explore and look at these solutions. And Remedy Home Healthcare, you're one of our members. Yes. You mentioned you might be willing to work with us as well as we approach this huge problem that we're seeing. So we'll see. Do we have your information in the chat by any chance?
We'll drop it in. Also, Kathria, if you don't mind giving us the area, we are in partnership.
It's in Palmdale.
Palmdale. So we do know a lot of doctors that do mobile visits. We can maybe refer a list of doctors where this individual can he can look at, or his brother can look at, and then contact them, because that sounds very, very unsanitary.
He needs a doctor today.
Yeah.
You're right, he does. You're right.
I know a number of, there are a number of doctors that are doing home visits. There's groups that are doing it. That's why it's about the money. I don't know if they'll do it, how much it costs.
I mean, I think they can do private pay for, I just said, we have to start somewhere. And then you just carry on with your Medicaid later on with the home health when there's a doctor's order to help him with all these open wounds and stuff. So they're willing to pay. But the problem is in Palmdale, we can't find, traveling, even a nurse practitioner. There's no one who's willing to visit. And he's COVID free. I mean, I checked, and the house is just something that you will be very scared to go in, because once you open the door, it's just,
Could you do us a favor? I don't know, at least for me and Joyce, if you could just write up a little paragraph about the situation,
right?
Throughout, and we could distribute it to our senior specialists. And believe me, among the, how many, you know, we have 9 specialist groups throughout Southern California. And there will be somebody that will have some good solutions that might help here. So
Thank you.
please send it to us and we will do
Yeah,
it.
I have my information in the chat, and we will put it out. So please send us the information.
Yeah, Ara is helping me on this. She can send you those things, and you know, greatly appreciated whatever help you can, because I can't do it alone.
No.
And he does really need help ASAP. I'm
And
sorry.
Katria, I don't know if you saw Evelyn. So Evelyn Passis is also here. She's from, I don't know if she introduced herself. She's from Valley Presbyterian Hospital, but I think she had a question for you. Evelyn, do you want to ask it? Evelyn, are you there?
I don't think she's connected to audio, it looks
I
like.
think she's this other, the other phone number here, no?
She said her mic is out.
Oh, okay. So Evelyn was asking if if he maybe has a private health plan, because he might be able to get help through case management through that health plan. Do you know?
No, they don't have. They're actually very scared of APS, because they have abandoned him so long that anybody, you know, anyone from APS can just come in, and he didn't want to go to a facility, and I don't think there's a place for him in a facility, even an ARF, which is the adult residential facility, because he's in his right mind. So if he goes to ARF, which is because that's the place who could be put in, not the RCFE, because RCFE is 60 plus, then he will just, you know, he's a little bit suicidal too. So the only place that we can really help him out is either in his house or in a hospital. That's where his head, you know, he's leaning into getting help. Very hard to convince. So, okay, that's it. All right. All right. Thank you for your help. I mean, I will look for, Ara will be sending the short notice about this, and whatever help will be, you know, it's greatly appreciated and very much welcome.
I mean, I appreciated hearing that, sharing, because for me, that shows the strength of what it means to gather together as this group, you know, and kind of having this kind of a roundtable, and how do our different businesses, how are they able to help each other? So I appreciate, and never apologize for the work that you're going through with, you know, with going through the clients. Like, never apologize for that, because I mean, it's so, what you all do is so difficult. And, you know, some of the things that you see, I'm grateful for people like you. So thank you for what you're doing. Appreciate it. But yeah, I don't know what other things, let me just kind of review what I've heard. Oh, sorry, go ahead, Dan.
I just have a question for everybody. How is the COVID testing going, if you know of it? You know, in the past, it's been like 2 weeks to get back your results. Now we're down to maybe 3 days, I found a place in Oxnard actually that gets it back in 20 minutes. I don't know how good it is, but they turn it around in 20 minutes. But that's the kind of thing you need to stop. I don't know if you know, we have caregivers that are going out, and if they come in contact with COVID, we have to get them tested, and we can't wait 2 weeks. Even 3 days is a killer. And then we have to pay. I mean, a lot of places are charging like $200 for a COVID test. So I don't know if any of you have resources or finding out what the testing situation is in this area.
I can tell you, I think they're slightly off. I go to one, and they'll test and get the results in 15 to 20 minutes, but you have to be exposed 5 days before. In other words, there's a 5-day wait after potential exposure. Otherwise, it's not going to work.
Oh, interesting. Okay.
Yeah. I mean, it's instantaneous almost, but you've got to wait those 5 days.
Okay.
Which cuts down the 14-day quarantine time quite a bit.
Yeah.
Paul, did you have your hand raised? Or Elaine, or one of you?
Several times earlier.
Oh, sorry. Did you have something to say about the COVID testing?
No, I got another topic, but I don't know if now's the time.
Okay. Sorry, Lainey, did you have something?
I was going to go to a totally different topic also, but if you want to go first, food insecurity was mentioned in the beginning, and I did want to talk a little bit about that. Maybe a whole nother meeting time, but there's so many services bringing food to seniors' homes right now. I'm surprised to hear that there's still the food insecurities, and if there's anything I can do to connect people to those services, I'm happy to do that as well.
That's great.
I think at the end of the day, what it comes down to is some people know about resources and some people don't, right? I think that's a big part of it's the educational, how do we get the word out to those that need it the most, or the ones that don't know and don't have that information. And I think that's kind of, I think that's where we need to find that connection. How do we connect that? Someone's not watching TV or listening to the radio or are not online. If they don't do any of those three things right now, how are they getting any info? So I think maybe that's kind of where that food insecurity thing came from, I think, for some people. But I will let Amy or Kaiser know, though, Lainey, that you have a bunch of resources, because I know she was concerned about that. So Paul, do you want to go to your?
Yeah, I just wanted to share, because of COVID-19, I've experienced a number of people that are over 65 that are losing their jobs. And I've run into a few already that were offered COBRA, and in some cases, COBRA paid by their former employer, and they think they're all set. And what they don't realize is COBRA is not primary. The moment they go on COBRA and they're over 65, any COBRA plan considers Medicare to be primary. So if they don't sign up on Medicare at the juncture in which they lose their group health insurance, they have a potential claims nightmare. Now, there's some legislation moving through the federal Congress to try to correct this, but it's not moving very fast. So if you know anyone that's leaving a group health plan over 65, make sure that they've signed up for Medicare in addition to COBRA.
Yumi, can I say something real quick?
Yes, absolutely.
I just want to put out there also that for anybody in the chamber that has an interest in us putting on an educational program for the seniors in all of your families, and for you specifically, so that you're educated on what's out there, we would love to do that. We have a whole list, and when we were sponsoring the Thirsty Thursday, I put up a list of all the different educational programs that we have, so I can send that to you, and you can maybe pick something or a couple of things, and we can do a program for you guys as well, so that you have an idea of really firsthand of what we do and the educators that we have.
Yeah, please send me that list. I remember seeing it, but yeah, please send it.
I will. Thank you.
And Fumi, I have an ask of the Greater San Fernando Valley Chamber as well. I know you have very strong ties and partnerships with all of the council members. And we would love whatever you might be able to do in that regard to get us some introductions, again, like Carol was mentioning, to let people know in those districts what we really have available. The foundation and the senior specialist groups are really too much of a well-kept secret, and we need the distribution channels we've been talking about. So if you can give us some introductions to some of your contacts in the district areas, we've often been asked, couldn't you have an SSG chapter and specialist associated with each district? Well, I think that's a very interesting idea that I'd love to explore.
Okay. Yeah, definitely. Let's maybe talk. Maybe let's have a little meeting and we can see which districts you have, or what connections you're looking for. Happy to do that.
I'd love it. Thank you so much.
Yep.
Joyce, I sent to you just a link through chat on the side that I came across. I'm not sure if it'll help at all, but I just sent it over to you. It might out. I don't know. Yeah.
Well, Stevie, were you gonna? I'm sorry.
Yeah, I was just going to mention just a reminder that there's a lot of great information that's in that chat list. And if you open that up, if you go to the very bottom, you'll see the 3 dots where it says more. If you click on that, it'll say save chat, and then that'll save all of that information on your computer so that you can access it later, or you can just do a Control-All to select everything and copy it and then paste it into a Word document, or however you want to do that. But make sure you're capturing all of the a lot of great information and resources that were put into that chat. And I think probably the biggest thing that may have come out of this call today is just the importance of getting that information out there. That there's a lot of great stuff that's available, and as a chamber, we will do what we can to make that more readily available for people to be able to access.
It is 10:57, so I know we had said this is going to be an hour. Was this something that you felt was useful and helpful? Was it nice to be able to meet with people within this industry? We just started to do the roundtables. We thought it'd be a great way to kind of leverage everyone's, different organizations together.
Great, just wonderful. Yeah.
Oh, good. Thank you for. We thought it. I know Eric and I and Steve. We thought it's great. It's been really nice to also hear directly from you. We obviously hear different things, and just to see different, like Lainey does so much. The community, I feel like she knows everything about the North Valley. But just to kind of make these connections, I think is really important, and like Paul, who has just been in that, the senior insurance realm for so long, literally the expert. He's the only person I would probably ask these kinds of things to. He knows everything. But is this something that you'd want to do again? Is this something, this is kind of a senior roundtable? I don't know how often you'd want to do, like every quarter. Kind of what do you think would be helpful? Just looking for feedback from the chamber.
I think that would be a great idea every quarter, because things change and evolve, and new information becomes available, and different needs become available. So I think once a quarter would be great.
Yeah, I think the chamber is serving as a great linking pin for people that are helping the senior community here. And it's just essential that we all talk. And I've gotten a lot out of it. I'm planning on talking to Lane and other people going forward. So it's good for me, I'll tell you that. I appreciate it. And I think good for the foundation that's trying to do the whole same thing to get resources together to help the community.
Okay, great. No, it's good to know. I think I really enjoyed this first roundtable. I certainly learned a lot, and I think I as a chamber, kind of what we can do is help you continue to make some of these connections. I think that's probably because you're doing the important part of the work. We're happy to help you make more connections. Anytime you need anything, please reach out to myself, to Nancy, to Steve, to Eric. Kevin's also our ambassador chair. Please reach out to him. We have a great group of ambassadors also. And whatever you need, however we can help, however we can try to make these connections, please let us know. But yeah, otherwise, I think this has been a really wonderful session. Like I said, it's being recorded, so I think we'll probably cut out some of the earlier chatter that we had, and then I'm happy to send this out again in case people wanted to kind of revisit some of the conversation that we had. But I also look forward to hearing, Katria, what happens. I know he's one of millions of clients out there that need that help, but I'd like to kind of see with the follow-up. I hope that he's lucky to have you on his side to carry enough to bring this kind of information forward. Yes. So please keep us updated on what's going on with him. And definitely. Please keep yourself safe. Please keep yourself safe as well. And for sure, Boston, everyone at Remedy too, all of you that have that one-on-one contact, please be safe and careful. Ada also. Nice to see your face, Ada, by the way. We always talk on email, so it's nice to see you. But thank you again. So yeah, we'll try to do this again then in a few months. In the meantime, if there's anything else, like I said, please reach out to us. And yeah, hopefully we'll see you on Thursday. We have it this week with the Long Beach Chamber. I think many of you have been on it, but basically it's speed networking, and we do it with a bunch of different chambers throughout the Southland. A lot of you have businesses that reach far beyond the San Fernando Valley. So I think these are really great ways to network. So we hope that you join us on Thursday. And yeah, we'll see you soon. Thank you so much for being here.
Thank you for coming out, everybody. Thank you for your time.
Thank you so much.
Great valuable
information.
Everyone.